If a woman finds out that she has fibroids, and the fibroids, she's not having any symptoms, she's not facing any complications, she's not having any infertility issues, she's going about her daily activities without any problem, not increasing in size, then it's advisable for her to leave it alone. Don't touch it. Don't take any medications for it. Don't take any treatment for it. Don't do any surgery for it. Guess what? It will shrink when you progress to menopause. Yes, as long as it's not increasing in size, it's not affecting anything, leave it alone. Welcome back to my channel. I'm Chidima Michelle Oswagu, a certified nurse midwife and a nutritionist. And in this channel, we get to talk about mother, child, and family at large. So if this aligns with what you're looking for, then keep watching. What are uterine fibroids? Uterine fibroids are non-cancerous growths that is found in the uterus, that's the womb, usually among reproductive women, more in Black women. Most women with uterine fibroids will live a normal life. They will not need any treatment, they will not need any medications or surgery, depending on the location and the size of the fibroid. And it won't even affect fertility. They'll be able to have their babies with no complication, living their normal lives. Now we're going to talk about the location of fibroids. Now, looking at this is the womb of a woman. This is what it looks like in every woman. As long as you're a woman, this is the shape. Looking at this, these are your ovaries here. These are the fallopian tubes. This is the womb. This is your cervix. And this is the vagina, where sexual intercourse occurs, as well as of menses. After fertilization occurs around this place, this is ideally where the baby is going to implant here. There are various kinds of fibroids that can be in the woman's body. We can have the submucosal fibroids. This one is inside the womb. The subserosal fibroid, this one is outside the womb. The intramural fibroids as well is outside the womb, and the pendiculated fibroids. All these fibroids have nothing to do with infertility. They will not disturb you about having pregnant. The only one that has the chances of stopping your fertilization and making the woman able to get pregnant is the submucosal fibroid. You know why? Because it's located inside the womb. And this place is the place that the baby is going to implant and stay for 9 good months during pregnancy. And you can see that this fibroid is going to be obstructing the baby, making stay of the baby disturbing, frustrating, and unconducive. Stop miscarrying the baby because there is no place for the baby to stay. This submucosal fibroid is obstructing the baby's stay. Now, the funny thing that happens is that at times, this zygote, which is the baby, will still struggle to stay despite this fibroid. It will struggle, and find a way to implant and stay and start growing. Now, what happens is that this submucosal fibroid will start competing with the fibroid. Let me use that word. Now, when it starts competing with the baby, that's the zygote, both of them will be growing. The baby will be growing, struggling, while the fibroid as well will be growing. But at some point, this submucosal fibroid will suffocate the baby, and the baby goes off. And that is where you hear cases of intrauterine fetal deaths. Is the bad thing about submucosal fibroid. But for every other kind of fibroid, in as much as it's not inside the womb, most often this submucosal fibroid can be more than one. It can have 1 here, 2 here, 3 here, 4 here, and the baby needs to implant. So this is the one that disturbs the woman as regards to fertility. Now we're going to talk about the causes. One of the causes of fibroid is actually unknown. That means the cause, nobody can explain how fibroid comes about. So one of it is that it's unknown, which is idiopathic. The second cause of fibroid is that it's genetically associated. Like it's can pass from one generation to another genetically. Studies also show that there is a link between deficiency of vitamin D and having fibroids. Lack of exercise, prolonged exposure to estrogens. For instance, ladies who started seeing their menses from an early age, let's say like 9, 10 years. Now you see that from the time she starts seeing her menses, already exposed to estrogen for a period. Like she's always exposed to estrogen from that early stage. Women who took a long time for them to get pregnant, you see that they must have also been what, exposed to long period of what, estrogen. Women who take so long to go into menopause, they as well have a long period of exposure to estrogen. Symptoms. For most people, they have fibroids, but they never know. It has no symptoms on them. Some have heavy flows. Isn't about one tampon or one pads in 1 hour. Like the flow is then heavy. Painful menses. Like during their menses, it's so painful that it affects the activities of daily living. They can barely walk. They can barely do their normal things. Like the menses is very, very painful. This could be one of the symptoms showing that she could have what? A uterine fibroid. Fullness or pressure in the pelvic area, frequent urination. If this fibroid happens to be pressing on the bladder, simulate frequent urination. Constipation. Most often, if the position of this fibroid is pressing on the anus, it can cause constipation. Treatment options. We have the non-medical treatment, we have the medical treatment, as well as the surgical treatment. Now, for the non-medical treatment, you can talk about predisposing yourself to intake of things that can increase your level of vitamin D. You have to take food rich in vitamin D, like the omega-3 fatty acids, of fish, leafy vegetables, fruits. And the medical treatment has to do with hormone therapy, like the birth control pills, the IUCD, the Depo-Provera shots. These hormone therapies can help reduce the production and release of estrogen. Estrogen is just a hormone that feeds these fibroids. Now, what do they actually do? They help what? Increase the size and growth of these fibroids. Gonadotrophins. This can help shrink fibroids, especially before a surgical procedure. Iron supplements are given, especially for those who have already lost a lot of blood. For the surgical procedure, we have myomectomy. Now, during a myomectomy, fibroids are removed while preserving the womb. It's actually a very good option for those who are trying to get pregnant. Open surgical myomectomy. In this procedure, there's an incision that is given in the pelvic area. That is the lower abdomen. The womb is brought out, the fibroids are removed, and the womb is sutured and put back into the body. Laparoscopic myomectomy. In this part, small incisions are made and the fibroids are removed. Uterine artery embolization. Actually, what happens in this is that the blood supply to these fibroids are being cut off. Last on my list is hysterectomy. Hysterectomy is a no option, especially for those who are trying to get pregnant. Hysterectomy is total removal of the womb. Now, this option is likely chosen for women who are done having their children, or maybe they have risks of having more complications, so they just take up the womb to have peace of mind. Will bring us to the end of this video. I hope you enjoyed it. Endeavor to give this video a huge thumbs up. Subscribe to my channel if you've not done that, so that any video I post, you're gonna watch it. Turn your notifications. See you in my next video. Bye.